For the opportunity to speak today. My name is Lisa Reinecke. I'm the Homeless Solutions Director for True North Community Services, where we serve Lake Mason, Newaygo, Oceana, and Muskegon counties. So I oversee a bunch of our rural counties in West Michigan. My role includes managing housing programs, coordinating regional systems, and working alongside community partners to respond to housing instability and homelessness at both the local and system level. Working in rural communities, homelessness often looks a lot different than what everyone expects. It's less visible, it's very hidden, but it's just as real. And often more times it's a lot more difficult to address due to the limited resources, transportation barriers, and the geographical isolation. I think of Newaygo County, we're 800 and some square miles, no transportation in that community that's public, and trying to get out to individuals or get them to service centers is very hard. What we're seeing right now is a clear shift in who's experiencing homelessness. I've been doing this for 14 years and have seen a complete difference since 2020. And we are seeing more families and more seniors on fixed incomes and more individuals who have never needed the help before. Many of the households we serve are part of the asset-limited, income-constrained, and employed population, the working families, who are doing everything they can do to stay afloat, but they are not able to keep up with the rising cost. One of the most concerning trends that we are seeing in the rise in older adults experiencing homelessness, according to the National Homeless Coalition, 1 in 5 homeless individuals is elderly. In our community, in 2025, we saw a 29% increase in seniors who need an emergency motel placement, which is what we utilize because we don't have homeless shelters in our rural community. And they are staying 40% longer than they had before because there's nowhere else to go, and we want to avoid getting them back out into those really unsafe conditions where they're already really vulnerable. So the seniors on a fixed income are being priced out of housing, and when they lose stability and the barriers to regaining housing, they're just significantly higher, and they're more at risk and vulnerable. We are often working with individuals who are navigating health challenges, limited mobility, fixed incomes, and no longer matching today's housing market. We just recently helped an individual who became unhoused because of the funeral expenses of their husband. It was pretty horrible. And across our communities, the reasons people are becoming homeless are increasingly tied to economic pressure. Rent continues to rise while wages are not keeping pace. And everyday expenses like food, gas, and childcare and healthcare are stretching households really thin into their breaking point. For many, it's not a series of poor decisions. It's a car accident. It's a medical situation. I don't know how many times I have heard that someone started having seizures and they could no longer get transportation to and from work because they couldn't drive anymore, and then they lost their employment, and then they become unhoused. That is, the medical concern has been huge in our communities. As I mentioned earlier, in rural areas, we are faced with additional challenges. There is a severe shortage of affordable housing, limited shelter options, and transportation that make it very difficult for individuals to access employment and services. Many individuals are staying sometimes in doubled up situations, but I can't tell you how many times I've gone out in the Manistee National Forest on some tree tracks and worked with individuals who have been identified by the National Forest Rangers. We call it forest outreach, and we're going out in tents and campers and working alongside them there. They're pretty hidden, but they're all over. One approach that has been really critical in the work that we are doing is housing first. This means recognizing that housing is the foundation, and it's the stability that really needs to come before challenges are addressed. We often find that mental health and substance abuse are happening because of homelessness, not why they become homeless. And once they get housed, they can work on those and other things to get stable and meet equilibrium. At True North, we focus on walking alongside individuals on their journey, often during the most vulnerable moments of their lives. We use a person-centered approach that prioritizes dignity, choice, and trust. Dignity is so huge in keeping that and building those relationships where we can do case management. Through our rapid rehousing program and permanent supportive housing programs, we have seen strong outcomes. We close somebody out of one of our programs, and we're seeing in 2 years, we have less than 1% recidivism rate. That means these individuals are staying housed even after 2 years of us closing out of them in a program. Our programs can last up to 18 months depending on which one, but most of them are about 6. So what is working in our community is the collaboration. We have really great working relationships and partnerships that are unique. We work with the local libraries, we work with landlords, we work with the National Forest Rangers, as I mentioned earlier. And because of this, we can hopefully rapidly house people, but we can identify anybody who's experiencing homelessness and start doing the case management. But at the same time, the need has continued to outpace available resources, particularly in prevention funds. We have people who will call us up and say, hey, I'm behind on my rent and I know I'm not going to be able to make it because of a funeral expense or maybe a medical bill. I don't have the funding to prevent that eviction from happening. And once that eviction happens, then we're really facing some crisis. We can try some diversion and help finding other opportunities, but that prevention fund is pretty important as well. So the reality is that homelessness in rural Michigan is growing. It's becoming more complex and it's impacting populations we have not historically seen at the scale. We also know that what works is case management and support and relationship building and keeping people's dignity intact. At True North, we believe that healthy and sustainable communities are built, not found. Thank you for your time and your commitment to helping end homelessness here in Michigan.